Hi, I'm Dave Clark. In order to bring health care to public housing and low-income residents, the LA County Community Development Commission has established a series of local health clinics. The one behind me is the Mary Henry Telemedicine Center. It's located at 10901 South Vermont Avenue. The nearest intersection is 109th Street. Through advanced computer networks, these clinics are linked with hospital-based physicians. These doctors can see and speak with the patients just as if he or she was examining the patient in person. Now, one advantage is our patients can receive care earlier, so their symptoms can be brought under control faster. And the telemedicine suites are right in local housing authority neighborhoods. This means people don't have to travel far to get medical help and are more likely to keep their vital health care appointments. Lastly, if patients get care without a long delay, they're far more likely to comply with medical instructions and take better care of themselves.
Hi, good morning.
Hi, good morning. How may I help you?
Hi, I'm Mr. Mendoza and I have a skin condition.
Okay, sure. Just fill this paperwork out and then the doctor will see you right away.
Thank you.
You're welcome.
Here you go.
Thank you.
Can you also tell me something about telemedicine? What is it?
Sure, the medical assistant, Sonia, she's going to take you to the nursing station. She's going to take your height, your weight, and your vital signs. They include the temperature, your pulse, your respiration, and your blood pressure. Then, our physician assistant will take close-up pictures of your skin problem with a derm camera. It sends pictures to Martin Luther King Center through a high-speed computer link. The specialist skin doctor there can diagnose your condition by looking at your pictures and checking your records.
So he's all the way over there and I'm over here?
Yes, that's how it works. Now I'm going to input your information into the computer and give you a chart number.
Thanks.
Mr. Mendoza,
That's me.
can you please come with me?
Yes.
How are you today, sir?
Fine, how about yourself?
Mr. Mendoza, you can have a seat right here, please.
Thank you.
Please understand that the telemedicine consultation is completely painless, so you don't have to worry, okay?
Thank you, that's good.
The physician assistant will come in now, and she will examine you and set you up for a telemedicine consultation, okay?
Good.
Okay.
Hi, Mr. Mendoza.
Hi.
This equipment connects us with the live doctor at the hospital. Both you and the doctor can see and talk to each other through the computer. The advantage of telemedicine is that the doctor can say, well, now let me see this other part of the body, or let me ask these questions. We can also look at a lot of other physical conditions with this system. For example, the electronic stethoscope is for the heart specialist. There's a sensor that collects lung as well as breath sounds as well as heart sounds. The laryngeal scope is for looking at the mouth for dentistry or oral care. And see, Mr. Mendoza, this is the actual derm camera that I'll be using to take sharp close-up pictures of your skin. What I will do is save the images here, and then I'll capture several other close-up images. For your dermatology exam, we'll look at the general area first, and then we'll check out the wound color. If there is a lesion, what we'll do is measure it.
What's the lesion?
A lesion is an injured or diseased area of the skin we want to fix. We observe wherever the lesion is and then capture the picture. What I'm actually doing is taking live camera shots of your skin lesion and having it transmitted through the computer via internet over to the dermatologist who sits at the hospital.
Amazing.
Yes, it is. So ready? I'm calling the doctor right now. I'm connecting. Here we go.
Good morning, Mr. Mendoza. How are you doing today?
Muy bien, thank you, doctor.
Since how long did you have this lesion on your hand?
I had it for about 4 days.
Did it bother you at all?
It's a little bit painful to touch. It's a little bit swollen.
How did it start? Did you get hurt? Did you have a scratch? Or like insect bite, like mosquito bite?
Not directly, but I do a lot of gardening.
Did you apply anything on it? Like a cream?
I put a little antibiotic ointment on it.
Okay. So do you know the name of the antibiotic cream? Because like sometimes like it doesn't help, like sometimes the skin get irritated or something, so.
There's some generic ointment, I'm not sure.
Mr. Mendoza, do you have any funny color discharge like yellow and green?
Maybe at first, but it doesn't seem to be doing that now.
Uh-huh.
But the area seems to be growing.
Mr. Mendoza, Rachel is going to show the lesion again on the derm cam. How are you cleaning it?
Just regular hand washing, soap and hot water.
Okay, Mr. Mendoza, what I recommend is that you clean it very gently using a mild soap, no more than a few times a day. Wipe the edges with a little alcohol, at least twice a day. Then apply the antibiotic. And even after that, if the irritation from the cream continues, stop using it and use the petroleum jelly, that is plain petroleum jelly, twice a day. Cover it with a band-aid and most likely the lesion will heal.
Okay.
And if you find that the lesion doesn't heal within 7 to 10 days, I would recommend you that you should follow up here at the Medical Center Dermatology Clinic.
I understand.
However, if you get any redness that goes up the arm, any swelling or pain, come back to the Mary Henry Clinic right away. Then they can refer you to see me in person if you need it. This is very important.
Entiendo.
Mr. Mendoza, this is likely what we call a traumatic superficial skin injury. Generally, they are not too serious. It should get better within 2 or 3 days, as long as you follow my instructions.
Gracias, doctor. That makes me feel better.
We'll just keep an eye on how it works in case if you have any other side effects. And if you show any other infection, signs of any infection like fever, anything else.
Thanks a lot, doctor.
Of course, Mr. Mendoza, we are here to help you.
It's pretty remarkable. By utilizing the telemedicine system, both the patients and the medical providers benefit. Patients get care much earlier with their medical problem. That means we can catch a disease before it becomes serious and more costly to treat. With telemedicine, housing authority and low-income residents get care in their own neighborhoods without extensive travel. Doctors can care for more patients right from their own offices. Everyone saves time and hassle trying to move around in clogged traffic. In this way, the Community Development Commission is bringing health care to our residents. It's like a hospital without walls. This is Dave Clark reporting.